I'll be in Auckland joining Minister Williams to open Mahitahi Trust Papakainga public housing development in Otara. I'll also be helping launch a Maui dolphin drone project at the Auckland Viaduct. The project involves using drones to find and track Maui, which, as we know, are critically endangered. I'll turn now, though, to decisions taken by Cabinet today in relation to COVID-19 in the country's alert level settings. Since midnight Wednesday last week, Auckland has been at alert level 2 and the rest of the New Zealand at alert level 1, following the emergence of community cases of the virus in Papitoetoe. We said Cabinet would review those settings today, and it has done so. Since the 3 cases arose on Sunday the 14th of February, we've undertaken 72,368 tests. The 8 cases that have emerged as a result have all been linked. All close contacts of the original cases returned negative test results, other than the cases that we've already identified at Papitoetoe High School and their family members. All further cases have been genomically matched to the 3 cases and are linked to the close contact at the school. Serology on the close contacts at the LSG workplace of the mother in the initial cases all returned negative results. We've carried out wastewater testing across Auckland and other parts of the country, which produced no evidence of COVID clusters. As such, on the advice of the Director-General of Health, as of midnight tonight, Auckland will join the rest of New Zealand at level 1. This decision reflects the incredible work on the part of all New Zealanders over the past week, and as always, we thank you. Our strategy has not changed when it comes to COVID-19, and nor has our plan. There is a predictability to what we do, and that has served us well. The recent cluster of cases, though, has been a stark reminder that, for as long as COVID is widespread in the world, it remains very much a part of our lives too. That's why it's so important to keep up with the good behaviours that have allowed us to move Auckland back to level 1 tonight. Accordingly, Cabinet has decided to continue to make face coverings mandatory on all public transport across all of New Zealand at both alert levels 1 and 2. In small passenger vehicles like Ubers and taxis, drivers must wear a face covering. And while it is not mandatory for passengers, it is encouraged that they do too. People will be allowed to remove face coverings to eat, drink or take medication on public transport journeys, if eating and drinking is usually permitted on those journeys. Children under the age of 12 are exempt, as are people with a medical condition that prevents them from wearing a mask or face covering safely or comfortably. There are a few additional exemptions, such as charter services and tours, and I'd encourage you, if you have any questions, to familiarise yourself with those rules on the Unite Against COVID-19 or Ministry of Health websites. Drivers and transport operators will not stop people without face coverings from boarding public transport. This is because some people will have legitimate reasons for not wearing a face covering. But where possible, drivers will be encouraging passengers to wear a face covering. Please, as always, be kind to public transport staff and drivers when they ask you to wear a face covering. Remember, they are just doing their job. Aucklanders have already been wearing masks on public transport since late last year. I hope we can make it a part of normal life. We will keep this order under review, though, particularly as we roll out vaccines across the population. So in the future, we may give updates on that requirement for face coverings. In terms of the COVID Tracer app, please use it. Any complacency in this regard means that in the event of a future outbreak, we may not be able to contact people quickly and get them tested and into isolation as required. As a result, we could see the virus spread wider or faster than it needs to. A reminder to businesses that it's still a requirement to display your QR code during alert level 1. Please do so prominently so people can scan it easily. Our public health systems are improving all the time when it comes to COVID, but to stay at level 1 relies on all of us continuing to be vigilant and play our part. A quick update now on our vaccination program, which kicked off on Friday last week. On Friday, a small group of vaccinators were vaccinated. Then on Saturday, we commenced our rollout with our border workers. Jet Park worker Lynette Faiva said she felt privileged and honoured to receive the vaccine. Today, I'd like to say to Lynette and all those working tirelessly at the border, thank you. It is indeed us who are privileged to have you working on our behalf. We expect to have all 12,000 frontline border workers complete in the next 2 to 3 weeks. We'll start out gradually, ensuring we've got our systems right, and then we'll scale up. This is a huge and welcome milestone in our ongoing efforts to keep New Zealand COVID-free. Let's mark it and celebrate it, but let's ultimately keep going. Now happy to take questions. No, you'll recall that we've had a couple of hypotheses, a couple of theories that public health officials continue to pursue. All of them are considered, however, to be unlikely, and none of them have stood in the way of the Director General, Dr. Ashley Bloomfield, having confidence to recommend to Cabinet that we lift alert levels today. No, not at all. This was an individual who is within an existing family, so their other family members have already returned positive results for COVID. They've been in isolation. They are at a quarantine facility already. So no concern, nor necessarily unexpected.
Minister, can you report on the progress by officials towards the Trans-Tasman bubble and whether you're still on track to meet the March ambition?
So essentially we continue those talks. What I think is becoming clear, and this won't be news to you, Ben, is that there will be a level of flexibility in whatever arrangements we finally have. Because I think both countries want the ability to be able to determine whether or not border closures at any given time may be necessary. That then gives creates a number of knock-on effects. Making sure that we have arrangements in place where if we do have a sudden border closure, that those who are travelling are able to accommodate any sudden closures, and that likewise we have a system in place where if we are required to ask people to isolate or quarantine, we feel confident that we can do that well. No, I think actually really just the reality. There will be occasions when we may choose to act if we have concerns around internal borders or whether or not there's a flow of people coming in between internal borders where cases might arise. And likewise, Australia's demonstrated that they want some flexibility on their side. One of the complications has been we've always tried to work to a country-wide opening. But as we've seen, actually there's so much variation sometimes in the way we're dealing with different states that we have to accept that it's probably going to have, a level of unpredictability. We had at that point, we were giving a general guide around what we expected within the quarter. We haven't stopped the work, but again, when we're in a position to make firm announcements, we will. But I've never used that as a hard and fast. It's more important to get it right. Yeah.
Prime Minister, Scott Morrison has got vaccinated in his country's first batch. Why didn't he get vaccinated hard and early?
Yeah.
So maybe assure people or ease people's concerns?
Yeah. So, I think want isn't the right word. I am ready and willing to be vaccinated, and I absolutely will be. The important thing for me, though, was to prioritise those at the greatest risk. I'm not at the greatest risk. Those we needed to look after are our frontline border workers, the people who are coming face to face potentially with COVID every day. They were the priority. Yes, I want to model that it is safe, and so I will be publicly vaccinated, but I wanted to make sure those at the most risk were vaccinated first. I should add, I have a family member who are amongst that group, and so she's one of the people that really needs to be looked after. But I'll be encouraging all of my family members to be vaccinated regardless of where they work.
When you expect all of the at-risk workers to be fully vaccinated, doesn't the Pfizer vaccine take 2 jabs?
Yes, it does. And you will have heard reference to the fact that, well, actually there is some data emerging that after the first injection of the effect that it has, because it certainly has benefits from the first vaccine, but then after the second, a slight time delay, and then fully considered fully effective, up to a 95% rate of effectiveness. As we've said, those 12,000 workers we expect to vaccinate over a 2 to 3 week period. Then we move to their family members, and then we move beyond. And of course, we'll need the vaccines to continue to be delivered as we go.
Some questions about child poverty.
Yes, sure.
What are you expecting to see in the child poverty figures that are expected to be released tomorrow?
Well, of course, you remember from our child poverty legislation, the important thing for us is to look at how we've been doing across the past 2 years. Because we're looking at, against our baseline, how we're tracking over time. So I'll be looking out for that. I'll be looking for the full effects over that 2-year period of the Working for Families package, because none of our data to date has fully taken that into account. Ultimately, I'll also be looking at whether or not we've affected not just our income, our relative income measures, but what it looks like for material deprivation. That's a separate measure again, and that's asking ourselves, are children getting, enough healthy meals? Do they have shoes to wear to school? Do they have access to healthcare? So I'll be looking at both.
Is the fact that the household economic survey had to be stopped collecting data during lockdown, is that a problem?
No, as I understand, Statistics New Zealand are perfectly comfortable with the fact that the data sets that they had through till March. What I think it is important to highlight, and this would have been the case regardless, is that it won't pick up the full effects of COVID. And so that next data set will be when we'll see the full effects of COVID-19.
Do you think the government, will it miss the next year's 3-year targets?
Oh, well, no, I won't be making any assumptions about that until I see the full data set. Look, as we've already, as I've always said, what we did immediately when COVID hit, lifting general benefit rates, increasing the winter energy payment, and of course the benefits of having already indexed benefits to increases in wages, all of that will make a difference. But we do have an obligation, I think, to keep looking at the adequacy of benefits in New Zealand. That's what the working group asked us to do, and we've always said we have more work to do there. I'll come here and then back to you if I may.
How many more frontline workers need to be vaccinated in Wellington?
So we started in Auckland. So that first part of the program deliberately started in Auckland, and then from there, across the course of the next few weeks, rolling out to other sites. So Wellington, Waikato, Christchurch, and so on. The reason we've started gradually is that gives us the chance to test our systems. And of course, as you can imagine, as we move into different cities, it gives us the chance to test the logistical arrangements, which are quite complex when you're transporting a vaccine that needs to be kept at -70 degrees. Oh, I did promise I'd come here, and then forgive me, I will come to you.
Is it acceptable that the Ministry of Health is trying to gag the Mental Health Foundation?
Well, I wouldn't accept that charge. Of course, you will have heard me perhaps this morning say that in my view it's the Mental Health Foundation's job to advocate around mental health services and mental health provision in New Zealand, and I would expect them to do so.
Does your government believe it's above criticism?
Oh, as you've said, as I've already said, I absolutely expect the Mental Health Foundation to advocate on behalf of all New Zealanders and their access to mental health care. I have absolutely no issue with, critique and criticism. I will, of course, push back if I take a different view on the rollout of services, which we've been doing in earnest.
We have an update around, in terms of the vaccine rollout, do you know how many of those have been received by Māori?
Yeah, so I can't give you that specific figure. And what we'll be looking to do is give weekly updates on the rollout of the vaccine. We want to make sure we're providing timely information, but also make sure we're focusing on getting the vaccine rolled out. What we do know is that our border workforce is very diverse, and so I expect we'll see that diversity in that first 12,000 vaccines across Māori, across Pacifica, and across other ethnicities as well.
Do you also have an update around the work that's gone into ensuring that Māori health organisations, especially in rural areas, are becoming up to play?
And so we have, at two levels. On the one hand, we want to make sure that we're providing information that is targeted directly to those communities who we know are most gravely affected by COVID-19. So specifically, we're working with Māori health providers around communication for the vaccine program, but also around delivery. We know we'll be needing to go into rural and isolated areas. We want it to be as easy as possible to get a vaccine. Okay, I'll come with the last couple, yeah.
I've got a
Sorry, the full...
Full immunisation, so borders working being fully immunised.
Okay, taking into account the second jab. I need to go through the breakdown again of working through the full 12,000 and then coming back to family members. But you'll remember one jab, then a 2-week delay, then we come back through and do the second tranche after that 2-week delay. Of course, what we can do, based on the arrival of our vaccine, is get through those first jabs and in some cases start then the rollout of those second while we're doing first for others. But let me look at whether or not we've got a breakdown of how that will operate for you.
In relation to Facebook blocking news sites in Australia,
Yeah.
what harm does blocking news like that do to a functioning democracy?
Well, of course, you'll see that we are not the only country grappling with ensuring that we have a really robust media environment where people can access good quality journalism, whilst at the same time, revenue sources to ensure that that robust journalism is provided have dwindled and changed. And so Australia, of course, are looking for ways to address some of those issues. We are too, but we're using different avenues to pursue that. So the issue, I think, is global, even if we're finding different solutions. We are, of course, watching with interest what's happening in Australia, but at the moment, we're taking our own path. Yeah, Ben. Can I, sorry? Yeah. No. Yeah, so look, we will provide updates, but I am given that obviously there are, national security issues involved and some things I won't go into great amounts of detail around, but we continue to work with Turkish authorities on ensuring that whenever we have movement of the individual and children in question, that it is done safely, with the best interests of the children, but also safety of New Zealand at its heart.
Can I also ask, is it too late in the pandemic now to consider building purpose-built structures as the NAPSARs
Yeah.
outside central Auckland?
Yeah. Well, look, I mean, you ask a good question because as you'll know, we're talking very publicly about starting a mass vaccination campaign mid-year. Now, we anticipate our vaccine program will take, will take up to a full year. Most countries are banking on that as well. But in that time, we may well see or feel extra confident in the ability of a vaccine to stop transmission, and that may well change up what's required at the border. But in the meantime, the idea of being able, within those timeframes, to build purpose-built facilities that can hold up to 6,000 people is a significant ask. B, I question whether there's any value add. Ultimately, many of the issues we face have not been about the facilities, but about the fact that we have humans within them, and from time to time, you may well touch the same button or be in contact with the same rubbish bin, and that has been a path of transmission. So not always the facility has been the problem, but the virus within it. Yeah.
With the child poverty statistics out tomorrow, how much of an impact do you think the government's efforts will have on those statistics?
Yeah, well, look, only time and the data will tell. But as I've already suggested, the thing for me will be to go back to the beginning. Our targets were set against a baseline, and I'll be looking back against that baseline and saying, how have we done over the last 2 years, 2 years worth of data to make an impact on child poverty? And that'll give us a good sense as well of what policies are making a difference. What I expect is a message that says, keep going, there's more to do. Okay, thank you everyone.